All right, let's jump right into a topic that honestly doesn't get nearly enough attention because of a huge misconception. We're talking about breast cancer in men. Think about it for a second. When you hear the words breast cancer, what do you picture? For pretty much all of us, it's a woman. You know, the pink ribbons, all the awareness campaigns, they're overwhelmingly focused on women. And for very good reason, of course. But it creates this powerful and frankly dangerous blind spot. So let's just cut right through that myth with a simple biological fact. Men have breast tissue, period. And anywhere you have that tissue, the ducts, the glands, cancer has a place to grow. This has nothing to do with gender, it's just basic human anatomy. Okay, so if men can get it, you're probably wondering, how common is it really? Let's actually put some numbers on this so we can understand the real scale of the issue.
We've all heard that statistic for women, right? A 1 in 8 lifetime risk. Well, for men, that number is about 1 in 726. So yes, it is way, way rarer. But rare is not the same thing as impossible, not by a long shot.
Less than 1%. I mean, that sounds so tiny, it's easy to just dismiss it. But when you stop thinking in percentages and start thinking about actual people, that number becomes very real. In 2024 alone, we're talking about nearly 3,000 American men who will hear a doctor say, "You have breast cancer." That's 3,000 fathers, brothers, and sons. And that brings us to the absolute core of the problem here. Because it turns out the biggest threat isn't that the disease is rare, it's that the silence around it is so common. Here's the tough reality. Outcomes from men with breast cancer are often worse. Not because the cancer itself is somehow more aggressive, but simply because it's caught later. By the time a man finally gets diagnosed, that cancer has had a lot more time to grow, to spread, and that makes it so much harder to treat. And this comparison just lays it all out, doesn't it? It's the awareness gap. Women are taught about self-checks. They have access to routine screening. For men, it's often not even on their radar. A guy might feel a lump, and he'll think, oh, it's probably just a cyst, or maybe an old injury. And he might ignore it for months or even years. And that delay, that can literally be the difference between life and death. So the best way to fight this, to close that awareness gap, is to understand what actually puts you at risk. What are the specific things that can increase the odds for a man? Well, a few different factors come into play. The biggest one is just age. The risk goes up as you get older, with the average diagnosis happening around age 67. Family history is a huge red flag, especially if another man in your family has had it. Then you have things that can cause higher estrogen levels, like obesity or serious liver disease. And of course, previous radiation treatment to the chest and a rare genetic condition called Klinefelter syndrome. But beyond all those factors, there's another really powerful one we have to talk about, your genetics. For some men, a much higher risk is literally written right into their DNA. And the impact of these genes is just staggering. Take a look. An average guy's risk is tiny, just 0.1%. But if you have what's called a BRCA1 mutation, it jumps tenfold to 1%. And then, look at this. With a BRCA2 mutation, the risk skyrockets to around 7 or 8%. That is an 80-fold increase. It just goes to show you how powerful knowing your genetic status can be. All right, now we're getting to the most actionable, most important part of this whole explainer. If we're going to fight the danger of delay, we need to know exactly what we should be looking for. So what are the red flags? What are the physical changes that should make you stop and say, okay, I need to get this checked out by a doctor now? Okay, the number one most common sign is a firm, usually painless lump, and very often it's right under the nipple. But that's not the only thing. You got to pay attention to any changes in the nipple itself. If it starts to pull inward, if it's painful, or if there's any kind of discharge. Also look for any changes to the skin on your chest, like redness or dimpling that looks kind of like an orange peel. And please don't forget the armpit. A lump there is another huge warning sign. Now, if cancer is found, it's usually one of two main types. The vast majority of cases in men is something called invasive ductal carcinoma, or IDC. That just means the cancer started in the milk ducts and has already begun to spread into the tissue around it. A less common type is DCIS, which is an earlier stage where the cancer cells are still stuck inside those ducts. So what happens after a diagnosis? Well, the really good news here is that there is a clear, well-established path forward for treatment, for recovery, and for support. The treatment plans are really effective, and they're often based on the successful approaches that have been developed for women for decades. It's usually a combination of things, starting with surgery, and then often followed by chemotherapy, radiation, and maybe even hormone or targeted therapies, all depending on the specific type of cancer. And this part is so important. Because of that strong link to genes like BRCA2, The official guidelines now say that every single man diagnosed with breast cancer should be offered genetic testing. And this isn't just about guiding his own treatment. It can provide potentially life-saving information for his kids, his siblings, his entire family. Beyond the whole physical battle, there's a huge emotional one. And this quote, wow, it just captures it perfectly. The shock of hearing you have cancer is bad enough, but then it's amplified by this deep feeling of being totally alone. When you're a man with what the whole world thinks is a woman's disease, who do you even talk to about it? The great news is you are not alone. There are support networks out there built specifically for men. Groups like the Male Breast Cancer Coalition exist for one reason: to break that isolation and connect men with other guys who know exactly what they're going through. We started this whole conversation talking about how the real danger is silence. Well, the cure for silence is conversation. So I'll leave you with this question. Now that you know all this, who in your life needs to hear it? Your father, your brother, a good friend? Sharing this knowledge isn't just interesting, it could actually save a life.